Hi, everyone. This is Steve Delasan, and welcome to this week's edition of CEOs You Should Know. I'm excited to be joined by Dr. Baker, CEO, founder, and MD of Baker Health. Dr. Baker, thanks for being here today.
Thanks for having me.
We're excited to jump into your journey, learn a little bit about you, and most importantly, talk a little bit about Baker Health. So why don't we kick off today sharing a little bit about your background and really what inspired you to start off Baker Health?
Sure. Yeah. I'm originally from New Jersey. I'm a pediatrician by background. Born and raised in New Jersey, left for school, came back, and then spent over a decade of my career doing, what I didn't know then, but now I look at as traditional old school healthcare. So we were in a regular practice, doing great clinical work.
Mm-hmm.
Most doctors, wherever they're practicing, they're doing great clinical work. The problem is that's all we're doing, and we're a little oblivious to everything that's happening around us. And then after spending over 10 years doing that, went into corporate medicine. I worked for about 5 years at the largest healthcare company in the country, United Health Group. And so I got kind of the full end of the spectrum. I did,
Sure.
Old school doc work, and then I was all the way on the business side of it. And what I saw was, patients aren't satisfied with healthcare. I think anybody who's listening doesn't look forward to calling the doctor's office, going to the doctor's office, waiting for an answer, waiting to be seen. There's a lot of frustration. I think what folks don't realize, and this is the unlock that led to Baker Health, is that actually doctors are even more frustrated than patients. I think patients don't realize. Simple example, doctors, when you're waiting in the waiting room, usually the doctor's in their office on the other side, waiting for the time to be called to see you. And there's all the middleman. You're checking your insurance or the phone's ringing. And so my brother and I, he's the co-founder, co-CEO. He's an adult primary care doctor. I'm a pediatrician.
Very cool.
We said we could probably do something here. And so we spent some time actually. I took a year and a half off. I never thought I'd be retired at 40. And at 40, I stopped working for a year and a half, which I never thought would happen. Did a lot of research, went around the country, actually spoke to people around the world who were doing innovative things in healthcare. So pure tech plays, like apps for like healthcare wellness, all the way to like hospitality. And so we settled on 3 pillars, and we said, can we do practical technology in healthcare? We said practical because it's not that there isn't enough technology in healthcare, but most of it actually creates distance between the patient and the doctor. It doesn't bring you closer. And what I mean by that is we thought EMRs were going to be a great thing. Now it kind of stinks. You go in and the doctor's staring at the computer typing, not looking at you. You kind of wish you went old school pen and paper.
Yep.
The patient portal sounds great. You send a message, the guy doesn't get back to you for 3 weeks, right? You're like, can I just text him like I get an Uber? So we call it practical technology. So we have a proprietary app where you literally text your doctors, text your nurses.
That's great.
And in a second you get a response, or you book your reservation. We're close to taking phones out of our offices. You could just do everything through that app. So technology is one pillar. The other is holistic care. And so in the time we spent, I spent not working when I was examining other places, and now this is becoming a little more mainstream, what I'm about to say. But when you look at the healthcare statistics, the clinical outcomes in the United States, we have the most doctors, the most medicines, and the worst outcomes. And you look at countries that have a much simpler and basic approach to healthcare. You look at countries in the Far East where they prescribe yoga for back pain instead of surgery, where they focus on healthy diet instead of pharmaceuticals.
Yep.
And at some point, it's undeniable that they're getting it right and we're getting it wrong. So our primary care locations have yoga studios in the middle of the office.
Oh, that's awesome.
We have therapists in our offices and nutritionists that you can text. And so we look at the primary care doctor as an important, but not the whole picture in your relationship. So I'm a primary care guy, but I'm not the main relationship you have at Baker Health. It's with the whole team. And the team includes the nutritionist, the therapist. We actually have fitness assessments that take place once a year for free with personal trainers and so on. So the holistic approach. And the third is hospitality. And this was the one, that I had to really study. I was spending time. We do field trips with the team to like the Four Seasons or the Mandarin Oriental, and we studied kind of their hospitality. And somebody might say, well, what the heck does that have to do with healthcare? It turns out that the inability to be seen in a timely fashion not only stinks from an experience standpoint, but actually causes bad clinical outcomes, because then you didn't get the recommendation that you're 50, you need a colonoscopy. You come back a year later, Now that cancer that could have been caught preemptively is at stage 2. And you could take that for a million other things. Unnecessary ER visits. You couldn't get in because your kid's sick tonight.
Hmm.
Doctor won't see you for 3 days. You wait 2 days. Now the kid has pneumonia. This happens a million times a day. And so delayed in access care, or even feeling unwelcomed,
Hmm.
even if you can get in a sterile environment with cold people. Most folks who experience the healthcare system experience it in a way where they come in, somebody's not smiling at them.
Yep.
Here's a clipboard, go sit down, wait till I
Fill
call
this
you.
out. Yep.
Exactly. And so we believe that it's not only cool to be trained in hospitality, but it actually has a direct impact on the clinical outcome. So those are the 3 pillars that inspired Baker Health.
Yeah, it's a really innovative way to look at healthcare for sure. And I agree with you on that hospitality standpoint, right? Like a lot of times people don't love going to the doctor. So when you walk in and you get that cold feeling, it just kind of furthers that negativity. So being able to be a warm welcome and greeted that way, I'm sure makes a big impact on your patients.
Yeah, 100%. If you and I are chatting and I'm smiling and nodding, you actually have biochemical reactions to that. You have endorphins, dopamine, your levels change. And we know those hormones affect your health. So I'm not saying that because I'm smiling at you, you're not going to get cancer.
Yeah.
But I am saying you're going to feel a lot better about coming to the doctor, engaging in your healthcare. And so
Helps reduce some of that stress and anxiety of
100%.
walking into a doctor's office.
for sure. Yeah.
I know you mentioned your brother earlier, your co-founder, and I know you come from a family of physicians. How has being around medicine your entire life impacted, obviously, your career, but also Baker Health?
It's been great. I don't know. You can never know the counterfactual. You can never know what would have happened if that wasn't the case. My dad was a pediatrician. And so I think there's a lot of lessons we learned that inform even what we're doing today. But basically being in healthcare since the day I was born as a result of this, and always in primary care. Really, I think the biggest thing is as we're trying to fix all the problems in healthcare,
Sure.
and by we, I mean me and my brother, but also a lot of other folks trying to do innovative, disruptive things. What I find is a lot of the folks taking aim at healthcare, coming out of Silicon Valley or coming out of business backgrounds, see a problem and then try to apply a sterile analysis to it. And they're like, well, cost is high, outcomes are crappy. Let's move these. And what is often missed is the human element.
Mm-hmm.
And so I think being from a family of doctors and always being in healthcare, despite me talking about technology, we're very proud. We're actually building the first healthcare super app that we know of. So we have a full software development team, right?
Awesome.
So we do take that seriously. We do formal hospitality training. We take that seriously. But to be honest, what's still the most important thing for us is the doctor-patient connection. And we've had opportunities to use AI to erase some of the doctor interactivity, and we're not going to do that. So there's guys that are a lot smarter than me right now having a conversation that believe doctors are going to be null and void in 10 years. Like they're like, you don't need a doctor to do this. I think that's where we have a competitive advantage, and where the background coming from a family
Sure.
of physicians, because nobody ever sent me a Christmas card thanking me for the app. What they send you the Christmas card is, hey, it was 9 p.m. The office was closing. You guys stuck around. You saw him, and you found out he had appendicitis. And when we went to the hospital, they said if you didn't find it, whatever. Or when you diagnose somebody with cancer and you're there, the technology that helped you to do it, the lab work that helped you to do it, is useful. But in the end, it's the human connection that makes the difference. And I think that's kind of where we're able to marry all the new stuff we're doing and all the disruption with some of the good aspects of the old school healthcare.
For sure. It's the best of both worlds. You're
Yeah.
able to utilize that knowledge and that foundation that you grew up on and obviously went to school for, but also have that forward thinking leading into the technology and being able to bring them together.
Yeah.
So I'm sure that along the way, throughout the new approach and the new technology that you guys are utilizing, there may have been some challenges, especially approaching the healthcare industry with this way. What were some of those challenges and how did you guys overcome them?
I think the biggest challenge in the beginning was trying to explain to the market when we first started. It's been 3 years or so, trying to explain to them, hey, this is a different practice model. And people, when you walk in, like if you walk into our Williamsburg location, if you walk in, you're walking into a yoga studio on the ground floor. You have to go through the yoga studio effectively and past it to get to the doctor's office.
Mm-hmm.
And that's different.
100%.
It turns out once you've explained it to folks, they love it. But when they go to your website and they're like, is this a spa? Or like, what?
Like, am I in the right office?
Yeah.
Yeah.
And so I guess we created a little friction for ourselves in that regard. with the consumers, with
Hmm.
our members. We don't call them patients, we call them members because they're part of a holistic community. We don't treat patients, we serve our members.
Sure.
There's a whole linguistics that goes with it, and it's part of our ethos. But then on the other side is the people that we have to deal with, like insurance companies. So we don't get paid by the insurance company for the free yoga classes that our members get. And it's included in the membership, but we don't get paid by the insurance companies. That's a loss leader for us, right? But we think it's necessary if we're going to kind of, put our money where our mouth
Yeah.
is, so to speak.
100%.
And so kind of explaining it to the stakeholders on the financial side is difficult. And so that's why we have a membership based model.
Mhm.
So that's like the way we're able to solve for that. I think now in terms of the market, now we have a fair number of members. We have to do less explaining. Kind of, it's a community. They kind of talk to each other about it, and they all have. There's a lot of stories of success. Like, I mean, we just had our holiday party like a month ago, and my brother and I usually say a few words, and all I did was read an email I got from a member where her and her mother, who's like 70, was depressed, never exercised, was obese. And because she found us and our therapists and our yoga, she would have never done yoga otherwise because it was scary, but we had beginners yoga, so on and so forth, lost like 40 pounds, is no longer depressed, offer antidepressants. And so to do all that, it's not necessary. The healthcare system today is not built where
Yep.
it welcomes that. You kind of have to work around it and zigzag. And it takes a lot of creativity, and really the team, to be honest with you, the team that we have is second to none. And so
Amazing.
I think our members are the beneficiaries of that.
Yeah, 100%. It's a completely different mindset. I think you said it earlier, right? It's not just a lot of places just treat the illness. They don't try to prevent it. And I think obviously the yoga is one example of it. Can you dive a little bit deeper into that
Sure.
outside of just the yoga?
Yeah, sure. So Sharon's like our wellness director.
Okay.
So when our doctors get together and we meet, our meetings open with Sharon spending a few minutes helping our doctors de-stress and our managers de-stress. And so it's not only for our members, it's for our doctors and our team. If you go to our yoga studio, you might see Dr. Tung, who's one of our pediatricians, sitting next to you in a yoga class. Dr. Sarah Baker joined the Run Club with some of our members in fitness. And so our team manifests it. They're very into it. We're doing a retreat soon for our team at, where is it, sir? Grace Farms, which is like a very holistic vibe. And so our team kind of embodies that. And I think what happens then is it's not a script being read in the room. When the doctors are being educated, they're getting in services on alternative ways to treat back
Sure.
pain or headaches or migraines, and you're not quickly reaching for a prescription pad. I think that's the only way to do it. It's not easy. I'm making
Yeah.
it sound easier than it is. It's a process we're learning. Every day I'm learning.
Yep.
We learn from a lot of our members. They'll come in and they'll be like, hey, here's a vitamin supplement. And then I'll go do research. And I'm like, that's awesome. The studies show that it helps. And so I'm going to give you vitamin C and zinc at these doses to overcome your illness instead of, another Z pack.
Yep. It just helps that you practice what you preach, right? It's
Yeah.
authentic to the mission, and having your entire team embrace that and participate in it probably makes it a lot more trustworthy when they're telling the members about those services.
Correct. Yeah.
That's awesome. So obviously you guys have accomplished a lot, but I'm sure that there's still a lot that you want to accomplish. So let's talk about your vision for the future and where you really see Baker Health going.
When we discuss our plan, like it's the new year just came. And
Sure.
so the executive team gets together and discusses what we're going to do. I think this is, and again, my brother and I have worked in what I call corporate medicine. So this is the opposite of how we did things back then. We do not have a business plan. We do not have quantitative metrics where we're like, we want to hit this many members or offices. That's the life that we left behind.
Yep.
And we're very anti-scale for the sake of scale. All our meetings, our executive meetings in terms of the future and what we're doing are all, what we do is we imagine one member.
Sure.
And then here's what we were able to do for this member's health 2 years ago. And 2 years ago, we offered them great access, texting through the app, generic medicines, and to avoid the ER and urgent care because we're open 7 days a week.
Yep.
6 months later, we were able to add therapy because we installed mental health specialists in our offices. 6 months after that, we added nutritionists. And so our roadmap is not numbers. It's this one individual, this imaginary member, and what can we add to them? So we added yoga. And so we have a lot of cool stuff that we're trying to add. Now, it does happen to be, and I could talk about what we're trying to add, but it does happen to be the case that when you do that,
Yep.
you get a lot more inbound requests. And so when we open a new location, which we do very slowly, like we're very tedious about where we open, and we're even more selective. We hire less than 10% of doctors that want to join us. When we do that, it's the result of folks wanting to get healthier.
Sure.
It's not the result of a business strategy that we have. And so what one or two examples of what we have that we're spending day and night focusing on, we're actually infusing, back to practical technology, we're infusing AI in a cool way. So you come in and you want to check your hormones and your lipid panel, and you hear about all these cool labs and longevity. So we order them. But what happens today is you have to wait, and then the doctor and you have to schedule a time, and then he or she's going to go over it. But then you forgot you have 30 questions, because after that conversation, it opens your, that's how it happens, right? If you're lucky enough, but at least we can.
Or you get the lab results and you
Correct.
Google everything.
Exactly.
And you're panicking and you can't get in touch with the doctor.
So our doctors are working with our team and AI, where it will tell you that based on your lipid panel, and then it looks back at all the cholesterols you got for the past 10 years. And then it looks at the American Society of Cardiology's metrics and says, if you continue down this trend, this is your cardiovascular risk. You have a 30% chance of a stroke in 4 years.
Wow.
And here's the 3 things that you could change immediately instead of like 30 pages. Here's 3 things you could change. You could reduce the risk from 30% to 8%. If you just walk this many steps and eat avocados twice a week or whatever. And so it's, again, back to practical technology. Yeah. So we're infusing AI in a way that can directly affect folks' health.
That's incredible.
And we just finished now, and we're taking it kind of to prime time in pediatrics. I'm going to be selfish and talk about pediatrics a second. The biggest epidemic in pediatrics is all the developmental delays that kids are experiencing, like autism, and really the lack of resources. So as a pediatrician, and any of the doctors listening will relate to this, if we have a 2-year-old that we think has serious delays, we can't get them in front of the right developmental specialist for over a year. So if you go Google Cornell, NYU, if you Google major academic center and say developmental pediatrician right now, literally you'll say taking appointments in 2026. That's what a lot of them will say.
Insane.
And we know that the child's prognosis is directly impacted by how early you could get in with therapies. So we took the onus. We established our own in-house child development program. Dr. Lee, who used to be a student of mine, she's a pediatrician, and we're building that out now. And we're able to get kids in with anxiety, ADD symptoms, developmental delays, not in a year, but literally within the next week within Baker Health, and plug them into all the services they need, speech therapy and so on. And so, again, that's just a focus on family. That's obviously not something that's a scalable model. But that's not what we're after. We took a family now, we added the yoga, we added the therapy, the vitamin infusions, and nutritional counseling. And now we know that 1 out of 4 kids have an issue. So for every 1 or 2 families, we're helping them solve something that's pretty unsolvable.
100%. You looked at the member and you found a potential issue that now your guys are a game changer for them, and you're getting them that immediate help that their child needs. So that's awesome to see.
Thank you.
I'm sure sometimes not everyone is able to embrace the holistic approach. How have you guys approached that as members? As you said, they might walk into a building and they see a yoga studio, and that's not what they're familiar with when they visit a doctor. How have you shifted that mindset about some non-believers, maybe?
The same way it happened to me, or the same way it happened to Zeyad, my brother, with education, like with compassionate education. It would be crazy to be upset with someone who comes in and says, give me antibiotics, my throat hurts, when the reason he or she is saying that is because guys like me have done that to them for 30 years. So of course they're going to say that.
It's instilled in their head.
Yeah. They didn't. So that's,
I'm sick, I need an antibiotic.
And that's our doing. We did that to them. And so what you do is you start to talk to them and you say, well, do you have a fever? No, but my throat, doc, trust me, the last 4 times this happened, I got a Z-Pack and I got better. And you say to them, no, you got better and you happen to be on a Z-Pack. And then you tell them, it's not uncommon for this. The following one, family comes in with 2 kids. Doc, we're going to Disney in 4 days. They got fevers. I know you tested them for everything, and it's negative, but just, I need the antibiotic. And I'll say, I don't send the antibiotic through the electronic health records. I'll write it on an old school script. Be like, here's 3 Z-Packs. Okay. And on the back of it, I'll write Sunday. Let's say it's Friday.
Yep.
They're leaving for Disney. I say, I wrote Sunday on it. I bet you they're not going to have fever. They're going to be perfect if you give them some honey and ginger and hot tea, some vitamin C and zinc. You have the prescription. You could walk out now and fill it. But if it was my kid, this is what I would do. And if Sunday they're there with a fever, you have the antibiotic. And almost 100% of the time, they're texting me something. They're like, "Doc, the kids are bouncing out." They send me a picture of them on a roller coaster ride, and they spare them antibiotics, which the average American's getting it 3-4 times a year. And then when they're 70, they need it in the ICU, it doesn't work anymore.
Yep.
So now when the kid does need it in 20, 30 years, it's going to work.
Yeah, that's so true. That's what people immediately jump to as soon as they think that they're sick. So that's a completely different approach. Yeah. So if you were talking to an aspiring health care innovator, what advice would you give them looking back, obviously, from your family experience, from your time in med school, from your time previously in the corporate space to now? Like, what advice would you give someone just starting in healthcare?
I think it would be to have like a very open and inquisitive mind. And I wouldn't go so far to say it has to be a completely heterodox approach. Again, I think some of the people that are coming into healthcare looking to completely disrupt it, are losing the best parts of healthcare that have to stay with us, like the human connection. And medicine, traditional medicine, does a lot of great things, right?
Yep.
The fact of the matter is, I'll give you one statistic that reflects this. You might have heard this, that out of all the first world countries, we rank dead last in like maternal fetal outcomes, and we're very poor in life expectancy, right? The interesting thing is, if you go to some of the best hospitals in the country, we're number one in maternal fetal outcome, right? Also, in terms of life expectancy, if you take out opioid overdoses, if you take out depression and suicide, if you take those things out, we become number one in life expectancy. Because
that's insane.
If you get to 65, and now you're in the ICU at Columbia Presbyterian, exactly. And so you have to kind of go one layer under. And so what I would tell someone who comes in saying, all right, I'm not the sheep. I'm not just going to get lined up and go work at be the 80th guy at a hospital where patient satisfaction stinks stuff. I want to do something different. I would say that's great. That's the first step. But the second step is you should look at what you learned in med school or what you learned in your healthcare courses if you're an administrator, and take the good with that, and then go marry it to the best parts of Eastern medicine. Go marry it to the best parts of technology. And that straddling, I think, is where we're going to be able to thread the needle.
That's awesome. Looking forward to hopefully more people having that mindset within healthcare, and definitely eye-opening statistics that you just shared. So we talked a lot about your mission, a lot about the amazing work you guys are doing, and really that innovative approach that you have. But if there's one thing that you want everyone that's tuning in to take away from your mission, what would that be?
I'd say that we think what we're doing is really cool, and we're very proud of what we're doing. But the stark truth is, what we do matters very, very little compared to what you do for your health. And I have yet to see a healthy individual who's healthy because of their doctor. And I think I could say this as a doctor who works 7 days a week, 24/7. I'm very proud of what we do. I think we make a big difference in our folks' lives, but that's necessary yet grossly insufficient. You're the main healthcare provider in your journey. You have to be informed. You have to be the co-pilot with the doctor and the healthcare team. If you are going to the doctor when you're sick for them to get you better, you will not get better. You have to, on a daily basis, be the main doctor. And every now and again, you need a guy like me to be a part of it.
Yep, that's great advice. If someone that is tuning in wants to become a member and they want to find more about Baker Health, what is their first step?
They just go to our website, bakerhealth.com, right? And they could download our app, right? So as I mentioned, we have a great app, and you could download it and explore it for some time before becoming a member. And
that's great.
We have like peek. Over 100 hours of free content, like virtual yoga.
Very cool.
If we have cool content like, hey, I'm a pediatrician. Hey, I think my 6-year-old has ADD, but I'm not sure. What do I do? And there's like a video on, does my kid have ADD? Or he's still peeing the bed and he's 8. So we have a lot of cool content on the app. You could also book your first reservation, come in for a vitamin infusion without calling the office. Just book it there.
That's awesome. Infusing that technology.
Yeah.
That's awesome. Yeah. Well, Dr. Baker, thank you so much for coming in today. Really appreciate you sharing your background and all the exciting stuff you guys are doing at Baker Health. I myself am definitely going to look into it. But thank you for doing all that you're doing and all of the advancements that you've been making within the important field.
Thank you for having me. This was a lot of fun. I appreciate it.
Thanks for coming in.
Thanks.
And thanks everybody for tuning in for this week's edition of CEOs You Should Know.